Welcome back to Sophia's Take. Mabrika, if you are here for the first time, thank you for being here. If you like what you learn, or you just want to be in community with me, please make sure you hit that subscribe button below. For any of you all that are coming back and listening, I really appreciate you being here. So today, I want to talk about a birth plan. A birth plan is super important for you to feel like you have control of the birth of your baby and you can have a positive and smooth cesarean section. Being a patient advocate is so important for our community. We all know this. You have a voice and you can use it to ask questions and get what you need. So part of making your birth plan is actually reading up on everything you can about delivering a baby via C-section. You should read about both vaginal and C-section births, but since you will be having a C-section, you definitely want to make sure you understand that the most. And even though you do plan to have a C-section, anything can happen. Right? So you understand about contractions and the things to be aware of if your water breaks, all of these things, even in an emergency C-section, you want to make sure that you understand what all of the different scenarios could be on that day, but plan for the most ideal, positive, and smooth baby birth that you can possibly have. You should take labor and prenatal classes to get a sense of the whole process. Do this with your partner. And sometimes your hospital will actually offer childbirth classes. And if it does, I do recommend that you do this because then you can actually understand more specifically as it pertains to your hospital and where you're going to deliver. This is something that me and Clinton did is our hospital offered the childbirth classes. So we actually took them and we met the nurse manager of the maternity floor, and it was just a very involved class and process. So highly recommend it if your hospital does that. And when you do this reading and you take these classes, you will get a sense of how you want to lay out your birth plan. Most people break down the birth plan into different sections: labor, delivery, newborn care, and unexpected. I wrote my birth plan as 3 sections: during my cesarean, after my cesarean, and newborn care. I'm gonna share all of this with you, but basically how I had laid out mine was having all of the information up top and then going through during my cesarean to after my cesarean to newborn care. Things that I included in my birth plan was remaining aware during the birth that I wanted an epidural and no narcotics. I wanted to take pictures to take place during the birth. I would like the screen to be lowered so I can see the birth of my baby. A description of the C-section as it's happening, and I would like low and calm voices during the cesarean. So these are things that I asked for during the cesarean. This is always hard after a C-section, but you always should ask if you want to do skin to skin immediately after the delivery of your birth. I asked for delayed cord clamping or delayed cutting the umbilical cord so that the partner can cut the cord. And if you are going to bank your cord blood, which is a whole other thing, and you can read up about that if you're interested, but you want to make sure that you put that in your birth plan as well. I also put after the cesarean that I do not want to be separated from my baby, that I would like to keep my placenta. I also discuss post-operative plan medications, like I would like to know what medications you're giving me before you give them to me. And I would also like all the procedures and medications done to my baby to be explained to me beforehand. For newborn care, I of course asked, I want my baby to be near me all the time. If it's a circumcision or if you're gonna do something like that, make sure you put that in your birth plan. And you can ask about immunizations, breastfeeding, and letting you know whether you want to use a bottle or a pacifier, right? So all of those sort of newborn care details. So that's really what I had on my birth plan, and it's just, I really made it 1 page, max back to front, but really if you could do 1 page, all on 1 page, this is what you will give to your surgical nurse and really anyone you want. I recommend you have a couple of copies. But this will lay out everything that you feel is important that others should know for the day of your C-section. And if you bring a lot of copies, then you don't have to think about it too much. It's all right here because it's a big day. You're thinking about a lot, your nerves, and you might forget something. So write it all down before and bring it with you to the hospital. The nurse that's gonna be with you for surgery should look through this with you and go through it beat by beat, and you have a right to ask for that. So there's lots of things that you're gonna learn as you take your prenatal classes, but I figured I would share them here as well. What I did when I made my birth plan is I also took notes about certain things that might be mentioned to me at the hospital that I didn't want to forget. For example, other things that you might want to be aware of is the medications that they might offer you, like Stadol, Phenergan, ephedrine, Reglan, Pitocin, a vitamin K injection for your newborn. All of these things, take a second, write them down, look them up so that you know what those are if they do end up being brought up after your C-section. The other thing that I recommend that you do as you're making your birth plan and you're thinking about the day is, especially if you are LP parents and especially if you know that your baby's gonna be an LP, you should have a consult with the NICU. And sometimes, you know, really what that means is it might be a telemedicine conversation or a phone call with someone that represents the NICU, and you have them tell you and you tell them what it is that you want them to be prepared for. So, hey, we are pretty sure that our baby is going to have dwarfism. Want to make sure that, you know, we're ready for that, whatever that means. You can explain that you have dwarfism. You can explain you and your partner situation. However you want to navigate the NICU conversation is up to you, but it's just important to have it so that there's actually a note record that this mother, that these parents are probably going to have a baby with dwarfism, or they might have a visit to the NICU. There's lots of things that they'll mention about the NICU. Again, that's something that is really like a loaded thing, and I'll probably do another video about that in another time, but it's definitely important to do a consult with the NICU and a consult with the anesthesia department of your hospital. You're having a C-section, you're gonna have an epidural or a spinal block or whatever they're gonna offer you, and you wanna make sure you understand what all of that is, and you really just wanna make sure that the hospital on the other end knows that you are a patient with dwarfism. We all know that there are so many physicians that just are not that educated about the nuances and the complexities of dwarfism. So the more that you advocate for yourself and you announce to the hospital, hey, we're coming, there's 2 dwarfs, a dwarf baby about to be had, you know, whatever the situation is, if you just make sure that the hospital knows what's going on, then you'll be okay. And at least you know that you did everything you could to set everybody up for success on that day. So I hope this was helpful. Definitely suggest making yourself a birth plan, especially as someone with dwarfism. It's just really important to keep it all clear for people to know what's going on. I'm gonna put some links in the description section below. I really hope this was helpful. And if you liked it, please leave a comment, a like, a thumbs up, and we'll see you next time. Bye.